Welcome to Sexology, a podcast that untangles the science of sex and pleasure. And now, with this week's episode, your host, clinical psychologist, Dr. Nazanin Moali.
Hello and welcome to another episode of Sexology Podcast. I'm your host, Dr. Nazanin Moali. If you are looking for ways to improve your sex life, I developed this sex quiz specifically for women, and the goal of the quiz is to help you pinpoint areas that you might be struggling with, and also I offer some recommendation and strategy on how you can tackle some of those challenges. The quiz is very brief. It takes about 5 to 7 minutes, but you will have access to the results immediately. I am very excited about our guest today. Our guest is Katz Angel. She's an author, researcher. Her book, Tomorrow Sex Will Be Good Again, is releasing this week. And we're going to talk about her book. We're going to talk about how women can navigate some of the serious concern they have regarding sexual violence without foreclosing opportunities for their pleasure. We're going to talk about how some of the expectation we're putting on women when it comes to consent is unrealistic. So I would be curious to see what's your response to our conversation about consent. Before we jump into this interview, first I wanted to thank our sponsor, OMGYes.com. OMGYes.com is a website devoted to sexual pleasure for people with vulvas and their partners. OMGYes conducts and publishes the first ever nationally representative large-scale studies about specific pleasure strategies in partnership with Indiana University and Kinsey Institute researchers. What's interesting is I first learned about them at the ASAC conference I attended, I think 3 years ago, and I was fascinated with this website. So what it is, it provides you with the sex education you never had. And I think for me, one of the best way to learn about what works for other people, how can I spice things up, is around the conversation I have with my girlfriend. So, and I bet many of you guys can relate to that when you're talking to your friends about sex and what works for their body and with the partner and all of those fun conversations, you usually learn a lot about what you can do differently. At least I learned a lot about how can I change things differently. And this website is like that, like having a very funny, witty, sex positive friend that can tell you what you need to explore. It's very interesting because they have videos that they show you the techniques, and they have real people talking about their experiences. So I was just like looking at the website and I said, I'm just going to refresh my memory about them. And for 5 minutes, an hour passed. And that's what I've been doing during my lunch break. So you can check it out. They actually generously offered a discount to my listener. Their website is omgyes.com/sexology. If you want to get the discount, make sure you're following the URL we have below. And they're so generous that they're offering free personal access to clinicians and certified nurses. That's how I first got access to their website. So if you are a nurse or clinician, follow the instructions in the show notes on how you can apply to get free access. Without further ado, here's my conversation with Katz Angel. Hello and welcome to another episode of Sexology Podcast. I am so excited and honored to have Dr. Ann Katz. Dr. Ann, welcome to our show.
Thank you so much for having me.
I'm very excited about this conversation. We had 2 episodes on sexuality around like after cancer, during cancer, all of those things. But it is such a important and needed topic that I continue to get more questions about it. So thank you so much for making yourself available to have this conversation.
Thank you. I'm always interested in talking about this, and it certainly serves as a way of promoting some of my books. So thank you.
Well, thank you for writing those, because I think everyone loves to talk about kind of novelty, fun things around sex, but many people are struggling with real issues after going through this life-changing experiences. So I think your work is really appreciated and needed.
Thank you. Yeah, I think one of the things that happens often is, first of all, this can be a really difficult topic for people to talk about, even to their partner and certainly to their healthcare providers and their friends and family. Often the response that they get is, just be glad you're alive. And that's not living a full life. So yeah, any way that I can get the word out and really help people to find the words to start talking about it, I'll take that opportunity.
Well, you brought up such an important point that people think, oh, you must be grateful because you survived this life-threatening situation. And it almost feels like not as important to address the sexuality piece, which is so, and me and you both as sex therapists, we know how important is sexuality for all aspects of our life. So I'm kind of curious, how did you get interested in this field of work?
Oh, it's a long and involved story. I'm a nurse by training. And after I finished my PhD, I went and did an intensive sex therapy program at the University of Guelph. And I had a very small private practice at the time. And, honestly, sometimes it felt that the couples that I was seeing, if they would just talk to each other and be kind to each other, right, their sexual problems were a reflection of the relationship and the problems in the relationship. So I really wanted to address a population that I felt, had really been neglected. And I went and I looked in the literature, and it became really clear to me that cancer was an area where there was a lot of silence and a huge need. So I wrote a proposal, sent it to our local cancer center, who basically said, come on down. I was full-time faculty at the university at the time, and they allowed me 1 day a week as my faculty practice. And so that's how it started. And that turned out to be the only day that I felt like I was helping people. So long story short, after about 2 years, I actually moved full-time to the cancer center. And this is what I do, in addition to some other responsibilities as well.
What a challenging and rewarding position to have, because I think it's just, as a nurse, you've seen kind of the medical aspect of things. And now as a therapist, you're helping people to kind of address some other psychological challenges that they have. What's interesting is I know that sometimes, as you said, like in the midst of treatment, people are not necessarily focused on their sexual wellness, which at times is understandable. But what I've been able to see is, like, after the treatment is done, sometimes when people are trying to reassess different aspects of their life, they find themselves at a completely different place that they used to be when it relates to their sexuality. So tell us more about that.
Yeah, so, that's absolutely true. And really, human beings are creatures of habit, right? People want to go back to the same level of sexual functioning as before, and that's often not possible. I do want to point out, though, that, there are people who are sexual during treatment or sexually active during treatment, sometimes not because they want to, but because they have to. So there may be some coercion in the relationship. And I've seen this with a couple of women where they couldn't refuse their partner because of, financial stability, etc. And that's not particularly easy to talk about or think about, right? But also, there are people who want to remain sexually active, even if they don't feel well, because that's how they connect with their partner. And I think it's a way of being alive and trying to retain that normality. But yes, this really does seem to be a survivorship issue. And often when people find out that I work in oncology, they get that kind of pity look on their face. Oh, it must be so difficult. And I say, to the contrary, by the time people come to see me, they've got through that trauma of diagnosis and treatment, and they just want to go back to being the way they were before. And actually, that's a really uplifting thing.
Well, what a wonderful service that you offer and the facility offer to help them to navigate their sexual wellness. And you're right. right that I haven't worked with women who've been coerced in having sex, which I'm sure it's some kind of type of a women that are experiencing that. But I've seen women out of guilt, kind of like forcing themselves and saying that my partner needs this, let me force myself to do it, or let me do my best. And I think that's also can be an issue.
Oh, absolutely. He was so great. He did this and he did that. And yeah, absolutely. And then there is that guilt and that, willingness to really not think about their own pleasure. And I really do see a lot of that, particularly for women who've been treated for breast cancer and women with gynecologic or colorectal cancer, where they've had radiation perhaps to the pelvis and they're experiencing real dryness and perhaps always not using a decent lubricant. I can't believe how many people are still using KY jelly. It's just a terrible lubricant, and there are gynecologists and oncologists recommending it. And, they're not getting any kind of enjoyment. In fact, sometimes I hear stories like, it feels like I'm being stabbed by a knife. And real suffering.
Right. And as I'm sure you talk about it, even if you want to be a willing and kind of giving partner during these process, there are so many different ways that you can be sexual that doesn't put you in pain. So I think it's important for people to adjust that mentality. And I hear that the pain also, kind of painful penetration piece is common among survivors. Can you tell us more about that?
Sure. So for women, lubrication comes from the effects of estrogen on the tiny blood vessels supplying the tissues of the vagina and vulva. And I think that's really important. I never just talk about, vaginal dryness. It's often really vulval dryness or just at the entrance to the vagina. So chemotherapy is going to really shut down the ovaries of a premenopausal woman. And most of our estrogen comes from the ovaries. Certainly, radiation to the pelvis is going to really destroy those tiny blood vessels. And then also we have the medications like tamoxifen and the aromatase inhibitors that women are prescribed for 5, 10, maybe more as we move along years to prevent a recurrence. And those really either block or stop the production of estrogen. So vulvovaginal dryness is extremely common and it causes extreme pain for most women. The other thing is that it's often really difficult for couples to move from what they have been used to doing, right? Sex on Saturday night at 10 o'clock, whatever their usual sexual script is. And to really, to think about non-penetrative activities. And I stress that a lot. But, people are people, and what's been working for 20, 30 or 40 more years, that's what they think is normal. They've forgotten how much fun it was, perhaps, when, all the kissing and canoodling that you do before you're in a sexual relationship with someone. I mean, that's just so exciting and so much fun. But it's difficult often to just move the needle on that.
Absolutely. And as you mentioned, that it is challenging when you used to identify as a person who was very sexual and you were kind of like were able to have sex on demand. Now you have to kind of prepare for it, create a mentality around it. So that feels also like a significant loss.
Yeah, absolutely. And, I think it's Peggy Kleinplatz who talks about how, everyone wants sex to be spontaneous. But, when you think about it in terms of, should we go out for dinner next Wednesday night? Where shall we go? What does the menu look like? All that anticipation. People often don't think about that in terms of sex, right? Sometimes the planning is half the fun.
I like that reframing. And I think it helps people to be intentional about it. So if you're thinking about, we're going to have sex like that this particular time and we're preparing for it and we're doing all of this thing, you can kind of make sure that you're adding things that you like. So that can be a possibility. But also you mentioned about kind of real changes that happens in people's body. As you mentioned, that many women, that even younger women, that they go through treatment, that they can experience things that some women that they're experiencing during menopause or post-menopause, and that impacts their kind of self-identity. So when it comes to painful things like painful penetration, and I know that sometimes people who are not in treatment take a number of different medication, kind of use different kinds of cream, all those kind of things that helps them. is there any usual kind of safe kind of medical route that people can take to address that?
It all depends on the cancer and the specific makeup of the cancer. So, for example, for a woman with gynecologic cancer that is often not hormonally dependent, those women, for example, can use a local estrogen, which comes in cream, ring, or little intravaginal tablets. Women who've got a hormone-dependent breast cancer are often told that they cannot use that, even though there's really very little systemic absorption. That's a discussion that the woman needs to have with her oncologist and with a gynecologist as well. But there are many, many cancers, where it is safe, particularly to use some local estrogen, because that's the only thing that's really going to help with that kind of dryness. Moisturizers and lubricants, etc., they're Band-Aid, solutions. They're not the real solution. The other thing that, I see a lot of, particularly in women, is the issue of body image. And, what often happens is that other people are saying to them, you look fantastic, right? Which doesn't help if you're feeling terrible. And we're increasingly aware of the role of breast sensuality in a woman's sexual response. So women with breast cancer who are going to have a mastectomy will often choose to have bilateral mastectomy with reconstruction because they want the symmetry or, the aesthetic look, which doesn't always happen, but it really removes all the pleasurable sensations of the breast. And that's what we talk about when we talk about breast sensuality. And we're increasingly recognizing this. And perhaps more important, plastic surgeons and breast surgeons are beginning to realize this. And, so I think that discussion about, if you choose to have bilateral mastectomy, this is what you're going to lose. It's just, it's very difficult to have these kinds of conversations with women when they've essentially just heard that they have breast cancer. They're terrified that they're not going to survive this. They're thinking about their children and their partner, perhaps their parents, so they just want to survive this. And really they're prepared to sacrifice anything. And then, 3-6 months later, it comes as a huge shock when that source of pleasure is no longer there. And, we tend to have these conversations, maybe in depth, but fairly quickly, and at a time when perhaps the woman just really cannot make a truly informed decision because she's so terrified and traumatized.
Well, and I've certainly heard women that they got the double mastectomy and they waited to get the second part of the surgery. So they are at a kind of a more clear place about what they want because they know that even outcome can be varied. But you're right that in that moment, it doesn't feel understandably the most important aspect of this process. But you're right that it comes in a kind of spectrum of challenges that women experience. For some women, their sexuality and sensuality were very connected with their breasts and it was part of their identity. And I have clients that they didn't necessarily love their breasts, but you're right, the sensation was part of what they're turning them on. And now they feel, okay, I lost big part of this. Yeah. Is it possible to become re-familiar or kind of reconnected with our body to discover other erogenous zones after we're done with cancer?
Absolutely. But it's a long-term process. And, it gets mixed in with regret and guilt. And for some women, certainly their breasts never, ever become responsive to touch again. The other thing that I see a lot of is that certainly for the period, and sometimes it can be months or years after reconstruction, they don't have nipples and areolae. So what they have is a breast mound. I call them Barbie breasts. They're often inconsistent with a woman's age, right? A 60-year-old woman really shouldn't have upstanding breasts. And so for a lot of women, that absence, particularly of the areola, is very, very important. And I actually encourage women to get 3D tattooing because the nipple reconstruction itself, they'll end up with erect nipples all the time. And many women don't like that. It impacts on the kind of clothes they want to wear. So I often will say to women, hold off on the nipple reconstruction. Let's see what a 3D areola tattoo can do. And there are some tattoo artists who are just phenomenal and do such a great job. And that I find is a real game changer for women in terms of body image.
I agree with you. And I think more importantly is like no one having this conversation with people. How would you know? Even as a provider that I've seen cancer survivors, some of this information that you're sharing with me is new. So I think it's important to go to people who are familiar with this process and also understanding of the importance of one's sexuality. So I guess the other thought I have about this kind of like transition is it possible for women to have, like if they lost their orgasm, to regain it? Is there any kind of like a specific training that they can go to? Is there resources around that?
Well, I think the orgasms is a complex issue. But one of the things that I find really helpful is using a vibrator externally, because often there's this negative, thought loop in their brain about, I don't look the same, I've got these scars, et cetera, and that really gets in the way. So, I encourage patients, they've got to use a decent lubricant. Silicone lubricants actually are, I think, the best. They stay slippery the longest. They're not absorbed in any way. They really are quite inert. And then I talk to them about getting a vibrator and really using it by themselves initially just to figure out what feels good. And generally, the intensity of the vibration will often override those negative thoughts and that negative self-talk. And then certainly to incorporate it into, activity with their partner. If the partner's a male, many men don't know that they can actually use a vibrator as well. And I talk a lot to my male patients, many of whom have had a radical prostatectomy or surgery for colorectal cancer. And, it's kind of amusing when I mention it to them. There's this sort of look on their face, like, is she from Mars? And probably, but, that intense stimulation can really be helpful.
I like that you're talking about using strategies and tools that can help you to experience more intense stimulation at times. And what's interesting is at times my clients kind of tell me, no, I don't want to do that. Like, I think the challenge is that people at times are kind of fixated on the idea of, I must have the same sex that I had with my partner before. And as you mentioned, sometimes it's not even possible anymore. And it's important to think about other tools and strategies.
Yeah. And, I really, I've been doing this for almost 20 years with this particular population. And honestly, the couples who are able to move on with a sexually satisfying life are those who are mentally flexible, right? Who don't have those really entrenched sexual scripts, who are prepared to experiment a little bit. I use a lot of sensate focus exercises with couples, but once again, that's a challenge, right? It's a time commitment, it's effort, and people often want to just kind of rush through things and, sort of trying to keep them focused on, also I think the most important thing with sensate focus is it's actually not about your partner, it's about what you are feeling. And people just can't seem to get that.
Well, I love sensate focus therapy. I feel like those exercises are really effective if people are doing it. I at times make joke of it can be a broccoli of all sorts of kind of like sexual play, but it can be very meaningful. For our listeners that might not be familiar with the sensate focus exercises, can you briefly tell us about that?
Sure. So it's a series of exercises that the couple does together that really starts off with non-erotic and non-sexual touch, and then you proceed through stages. The last stage involves penetration, but you don't have to get there. It really isn't that goal-oriented. As I said before, the focus is on what you are feeling when you are stroking your partner's face or hand or back or whatever. It's really about the sensations that you perceive. The thing that I find really helpful about sensate focus with this population is because certainly initially it takes intercourse off the table. For women in particular, that is a huge, huge relief. Sometimes for men as well, particularly men who are not able to have erections after, for example, prostate cancer surgery, they are under such pressure and, performance anxiety and, every kind of, emotional pressure that you can imagine to perform. And so this really does allow them often to tune into an aspect of their own sexuality that they haven't really involved for a really long time because they've been so focused on penis in vaginal, penis in anus sex.
Absolutely. And I see the same pattern for all sorts of couples that they got stuck in this loop of negative sexual experiences. Sensate focus exercise that can give them a reset of like, let's reset and see what we can do differently and how can we connect with our bodies. So since we're toward the end of our time, if there are survivors that are listening to this episode, they're thinking about, I don't want to have kind of this sexual experiences. I want to kind of start focusing on myself, kind of like if someone haven't addressed it yet. What are some of the first steps that you recommend this women to take?
I think certainly talking to somebody, to a professional. It's really hard to talk to a female friend or a family member because there's lots of emotion and people don't necessarily say the right thing. That's often where you hear that, be glad you're alive, why are you bothering with this stuff? Certainly getting some professional help can be helpful. And then, bibliotherapy, right? Read some books. I've just actually published the revised edition of Woman Cancer Sex, which is a book for women who've had all kinds of cancer. There's a companion, Man Cancer Sex, as well. And these books are accessible. They really tell stories with evidence-based guidance in a really accessible format. So thank you for allowing me to promote that a little bit. And, but I think the most important thing is being able to talk to somebody, who can normalize and validate what they're going through, because people often feel really alone. Nobody's talking about it, right? Their oncologist is not talking about it. The nurse or the radiation therapist is not necessarily talking about it. And so frequently women come to see me and they say, this is what I'm experiencing. Have you ever heard anybody else have that? It's a universal experience. And I certainly wouldn't tell someone, oh no, that's the first time I've ever heard it, even if it is. But there certainly are, a lot of commonalities of experience.
Absolutely. And my invitation for listeners is that definitely hopefully talk to a therapist or sex therapist or sex educator about these things. Because I know that sometimes I work with lots of physicians, I have physician friends, and I know because they haven't had experiences and trainings in addressing these things, they don't feel well equipped. So maybe their kind of discomfort and lack of knowledge will appear during this conversation. It's definitely not your fault. They just don't have the information. So things like your book can be a great resource.
Yeah, and I've written books for healthcare providers as well. And certainly pre-COVID, I was traveling 2 to 3 times a month, generally educating healthcare professionals about how to talk about this. And, most of the time, all you have to do is ask the question and then just sit back and listen, right? So that the patient has a voice and you learn from the patient as well. So, yeah, there isn't adequate education. One thing I would say, though, is that, if you are going to see a counselor or a therapist or an educator, it's really important to ask them if they have experience working with people with cancer, because sometimes if they don't, they really may not give you particularly good advice. A woman with low libido because of body image issues or something related to the cancer treatment may not respond well to direction or advice about low libido with someone who hasn't been through cancer or any other illness for that matter. So, just a little bit of a caution there. Find someone with experience.
Absolutely, and interview people, because as you said, that there are a galaxy of people out there that they might claim that that's their expertise, but there are, as you said, there are a few people that I have the knowledge and information to support women and men in this process.
Yeah, absolutely.
Well, I know that you have your own podcast. You authored many books and publications. So tell us more about some of those offering books and publications that you have.
Sure. So I actually have a website, which is drannekatz.com. It's Anne with an E because that's the only kind of Anne. So DRANNEKATZ.com. So all my books are there. So Woman Cancer Sex, Man Cancer Sex. I've also written a couple of books for young adults with cancer, one of which is called This Should Not Be Happening, Young Adults with Cancer. I've written some books, general books on cancer survivorship, where sexuality is just a part of it. I just started my podcast, which is called Sexually Speaking with Dr. Katz. It's available on Spotify and Apple Podcasts. And, before COVID, I traveled all over the world talking about this. I miss those days.
Me too. But it's wonderful that you have this great website that people can find the resources now, maybe get started with reading the book, listening to your podcast. And when you're available to travel, then they can get to see you in person.
I also do some private counseling online, and a link to that is also on my website. So, today with Zoom and other ways of doing this by video, there's some advantages, but man, I miss seeing people in person. I really do.
Yes, absolutely. I absolutely can relate to that. The information about the website will be in the show notes. So if people didn't get a chance to write it down, it's available there. Thank you so much for being so generous with all of this wonderful information that you shared with us. And hopefully we'll see you in future.
Thank you so much.
I hope you found our conversation useful. I highly encourage you to get Catherine's book. And if you are a woman that you feel like you want to have a different relationship with your sexual desire, I encourage you to journal about what are some of the inhibitors that gets in the way of you having the sexual experiences that you want to have. And of course, our male clients are welcome to do that as well. Specifically, it would be interesting to think about what are some of the messages around sex that was passed on to you, and perhaps exploring how you can change that. Again, at the end, I wanted to encourage you to also check out our sponsored website, omgyes.com, and let me know if you end up getting the subscription, which one of the videos that you liked more. I've been loving, they're talking about this technique called there's champagne in the lobby. It's fascinating. So if you end up getting a subscription, please shoot me an email and let me know which one of those skills and strategies you have enjoyed more. All right, I'll talk to you guys next week. Thanks for listening to the Sexology Podcast. For more great content, visit www.sexologypodcast.com. Please be advised that information presented on this podcast is not a substitute for seeking help from a licensed mental health provider.